Hello, Prairie Grove Orthodontics family. This is Dr. David Hamm. Based upon the guidelines provided by the American Association of Orthodontists, American Dental Association, and Wisconsin Dental Association, there are certain emergency appointments that we are unable to see at this time due to the COVID-19 temporary closure. As a result, I'd like to take some time to answer commonly asked questions from you patients to help keep you as comfortable as possible while we're asked to stay at home and flatten the curve. The first step to minimizing orthodontic emergencies is to practice good oral hygiene. This includes brushing after every meal or snack for at least 2 minutes, followed by daily flossing. Next, requires eating a well-balanced, healthy diet, drinking lots of water, and staying away from the sticky or hard foods that could pop braces off. Management of loose braces depends on the location of where it is. If it is one of the last back braces that has come loose, you can try sliding it off the wire, followed by using a nail clipper to clip off any excess unsupported wire. If it turns out one of the loose braces is in the middle, you can slide that brace to its nearest neighbor and use a little bit of orthodontic wax to hold it in place. When we're able to see you next, we will rebond any loose braces. If you're in the middle of turning an expander, please continue your turns as we had previously instructed at your last appointment. If you've finished these turns, you do not need to do any more additional turns at this time. We will give you additional instructions at your next appointment. If you have an expander or Mara that feels loose but is not causing any pain, please minimize eating or chewing on the side that it feels loose until we can see you next. If the expander or Mara has completely come loose on one side, you can try to use your thumb to push it back into place. If the expander or Mara is loose and there's pain associated with this looseness, please call our office for additional instructions. If you are currently wearing rubber bands, please continue wearing your rubber bands as previously prescribed. If you feel you are very close to having your bite fully corrected with rubber bands, feel free to take some photos and email them to us. We're more than happy to evaluate the progress in your bite and give you any feedback regarding your current rubber band wear. The easiest and fastest way to manage a poking wire at home is to use orthodontic wax. Grab a small piece of orthodontic wax, roll it into a ball, and squish it in the area of irritation. If you've run out of orthodontic wax, you can substitute this using sugar-free chewing gum. Take the small piece of chewing gum, roll it into a ball, and squish it in the area that is irritated. If these remedies do not work, you can attempt to do a couple extra things as well. If you have a clean nail cutter, you can try to cut the end of the wire where it's poking. If this doesn't work, you can also grab a clean pencil, use the eraser end, and push the poking end back into the brace. If you've run out of wax, rubber bands, or your prescription fluoride toothpaste, please email or call us and we'll find a way to get you your missing supplies. If you have any additional questions or concerns, please do not hesitate to call or email us and we'll get in touch with you. We miss you, stay healthy, and be safe.